I'm concerned about the tax credits. Tax credits, definitely.
I think the biggest fear is that they're not going to be able to keep their rich coverage and be able to afford to continue the coverage that they're providing to their employees. And it's kind of a rite of a passage for a business owner, of an entrepreneur, to go out and get their own insurance and be able to provide insurance to their employees. So there's a lot of fear around that. There's also fear that they might not be competitive in the marketplace if they can no longer afford to offer insurance, and where their employees would go for insurance. This piece of legislation is very complicated. A lot of it has not been finalized. A lot of the provisions have not been finalized, and all that gray matter is nerve-wracking for the front line, so to speak, the small businesses that are offering this coverage.
Most of our employees are really expressing concern on the Cadillac tax, whether or not that will affect them or not. They're also expressing concern on, especially with the preventative max is going away. They cost share currently, so they want to know how that's going to impact them. They're concerned with maybe possibly the rates going up, how much will they need to put in. So we're trying to gather as much information so that they're educated, again, to make the best decision for them.
A lot of their concern is just based upon like the Cadillac tax that they're talking about, and taxing the plans that the employer already has. So they're concerned about that, whether they're going to be taxed, especially the retirees, with Medicare and all the different things that happens after you retire. So a lot of our members are asking about that. They're asking about just the basic services they get, the physicals, how will all of that affect the health care.
I think it's all been a lot to absorb and to take in, but I think more importantly, what I'm taking away from it is what is it that I need to worry about in the next 12 months, and then break it into 18 months and 24 months. And then going forward, making sure that we're constantly gathering all the information to be compliant.
Just asking a lot of questions, meeting with people, meeting with different vendors, just trying to find out all the information we can about our members. We get a lot of phone calls about a lot of different issues, so just trying to stay on top of things. Watching the news reports as well, watching the president and seeing, when changes are coming, the times that they're coming. So just trying to stay on top of everything and asking a lot of questions.